half of teens who experienced dating violence report that incidents of abuse took place in a school building or on school grounds. And whereas only 33% of teens who are in an abusive relationship ever tell anyone about the abuse, and only 81% of parents surveyed either believe teen dating violence is not an issue or admit they don't know if it is one. Whereas by providing young people, parents, and professionals with education about healthy relationships, warning signs of abuse, and relationship skills, and by changing attitudes that support violence, we recognize that dating violence can be prevented. And whereas the Domestic Violence Association of Central Kansas needs all of Saline County to work towards ending teen dating violence and by empowering young people to develop healthier relationships, assisting victims and assessing the information and supportive services they need, creating better and more resources for young people in need, instituting effective intervention and prevention policies in schools, and engaging in discussion with family members and peers to promote awareness and prevention of the epidemic of teen dating violence. Now, therefore, the Saline County Board of Commissioners hereby designates February 2021 as Teen Dating Violence Awareness Month and urges citizens to recognize and assist all those who serve the rights and needs of victims of teen dating violence.
Thank you. And at this time, do you have any programs, virtual or anything else coming down the road?
Yeah, the one that DDAC is doing on our own is on February 25th at 11. We're doing a Zoom meeting. You can find it all on our Facebook page. So we'll be hosting a Zoom training on teen dating violence and how to respond to that. And like, if you're a parent, how to respond for your kid. So that you can find that. And then all through the month of February, we'll just be posting different stats and resources that people can utilize for teen dating violence.
Okay. Are there any questions or comments from the commissioners? Seeing none, any members of the public who wish to speak at this time? I will bring it back to commission for more discussion or possible action.
Chairman, I move we declare February 2021 as Teen Dating Violence Awareness Month.
Commissioner Weiss, I second the motion.
It's been moved and seconded that we declare February 2021 as Teen Dating Violence Awareness Month. Are there any further comments? If not, I will call for the vote. Commissioner White?
Aye.
Commissioner Weiss?
Aye.
Commissioner Vidrickson?
Aye.
Commissioner Shadwick?
Aye.
Commissioner Sparks? Aye. Motion passes 5-0. Thank you, Caitlin.
Thank you very much for your time.
You bet. Move on to the next item.
RFA 115-21 bid award for 2021 pipe culverts with Justin Mader, County Engineer.
Good morning, Justin.
Good morning, everyone. So I'm here this morning to discuss and take action on the Saline County Road and Bridge Department request to award the bid for 2021 pipe culverts. Sealed bids were open on January 20th, 2021 at 11 a.m. And we just received one bid, and that bid was from Wellborn Sales. You should have in your packet the bid tabs that provides a little more details of the bid. So, and these materials are just to be used in our stock inventory. You know, they're not designated for a specific project, but as maintenance needs them, we'll have those available. Alternatives for action is to accept the bids as indicated in the staff recommendation, or two would be to reject the bids. Staff recommends to accept a bid from Wellborn Sales in the amount of $117,237.76 for the pipe culverts, in-sections, and dimple bands. The funds to purchase these materials will be taken out of the 2 mil or the 125 account. So is there any questions?
Justin, this is Commissioner Bob Vidrickson. Yes. I'm just curious, with just one bid, do we physically send these out to people, or do we just post them on our website and let them come to us, or how does that process take place?
So no, we physically, well, digitally email vendors. And so I did call. So in the past, we've only received, and really we only email them out to 2 vendors. And so I called the other vendor, and they're out of Hutch. And I talked to the rep. And for whatever reason, it kind of slipped through the cracks that they didn't submit a bid. They intended to, but it just didn't happen on their end for whatever reason. He was going to do some investigating to see kind of what happened. The last 2 years, though, the Wellborn sale has won the bid. And so anyway, so I asked, well, first of all, we did kind of an evaluation of Wellborn sales bid for this year and kind of compared it to last year's prices. And they're in the ballpark of about a 10% increase. And so when I talked to the other vendor, I asked them about what he's seeing as an increase on their side of it. And he's saying it's about that 10%. The material is just taking a big jump this year. So I'm confident that the prices that we have are good prices.
Yeah, and I'm not contesting that whatsoever. But I'd like to see us, if we can, broaden our, our scope of suppliers in that regard. I mean, 2 is just like this. If one of them fell through the cracks one time and we've only got 1 bidder, or something happens. So
yeah,
that's just my opinion.
There's just not a lot of people available that sell pipe. I know that, and it's kind of like equipment. When you buy Cat, you're buying a Caterpillar, from one vendor. So Contact makes pipe. They're a big pipe manufacturer. They only allow Wellborn Sales to sell their pipe. And I think they've got a plant in Topeka. And that's it for that. J&J Drainage is they manufacture their own pipe in Hutchinson. There's just not a lot of that. I can ask around to see if there's other vendors, around, but we have to be careful about it because sometimes you can get vendors, and I can just put it in the specs, that it has to be certified pipe, but what you'll end up getting is some reject pipe or pipe that's not certified. So we just have to be careful about that.
Okay. Any other questions from the commissioners at this time? Seeing none, is any members of the public who wish to speak?
Mr. Chairman, nobody has their hand raised at this time.
Okay, I will bring it back to the commission for more discussion or possible action.
Commissioner Shadwick and Mr. Chairman, I move we award the bid to Wellborn Sales, Inc. in the amount of $117,237.76 for pipe culverts, in sections, and dimple bands.
Commissioner Weiss, I second the motion.
Are there any further comments? If not, I will call for the vote. Commissioner White,
Aye.
Commissioner Weiss,
Aye.
Commissioner Vidrickson,
Aye.
Commissioner Shadwick,
Aye.
Commissioner Sparks, aye. The motion passes 5-0.
All right, thank you,
And
Commissioner.
excuse me, that is RFA 115-21 bid award for the 2021 pipe culverts. Excuse me, I missed that. Thank you. You have a great day,
All
Justin.
right, thank you.
Next item,
Item 3, review of amendment number 1 to resolution 20-2297, review of section 6 mask mandate with Jason Tiller, Health Department Director.
good morning.
Good morning.
Jason.
Good morning, gentlemen. Just as soon as Brad brings up the slides. All right, good morning. This is our update for February 2nd, 2021. Next slide, please. Before we get into the current state of things, I thought we should take a moment and reflect back that it was this time a year ago where we started having our first meetings COVID started showing up in the United States, and with our partners started preparing for COVID's arrival in Kansas and then later in Saline County. So in the preparation and planning phase of things, and in the response to this, it's going on a year now. Next slide, please. All right, so this is your national outlook for the last 2 weeks. US cases for the last 2 weeks are slightly down from the previous 2 weeks, as well as US deaths. Next slide, please. State situation over the last couple of weeks. I believe that number of 16,000 cases is probably the lowest number of new cases in the state over a 2-week period that I have seen in recent reporting periods. The same with the statewide deaths, so there's some improvement there. Next slide. And more importantly, we can see in the last 2 weeks, we've had significant improvement here in the county. Over the last 2 weeks, only 418 new cases, and thankfully, only 6 deaths have been reported. So we've had reporting periods finally where we were able to say that there were no new deaths, which is a very positive thing. Hospitalizations still continue to remain low. Our 2-week percent positive rate is staying well under the 10% lately, which is good. It continues to trend in the right direction, as well as our 2-week incidence rate, which is trending in the right direction. That per 100,000 is simply a benchmark that is used so that counties can compare apples to apples from county to county. So, next slide. So looking at the cases per month, we can see January was much better than both November and December. Again, we see that trend is looking better. February, so far, 57 cases in February, but that's still much better than what we have been seeing. In fact, our 2-day average, where at one time we were having 100 cases per day, has been less than 100 on our 2-day average. So we're still going in the right direction. Next slide. Same thing, deaths were a little bit higher than November, but much, much lower than December. And at this time, none reported in February, which granted it's only the 2nd of February and it's still early, but still we're headed in the right direction. Next slide. Still have a lot of clusters that we're continuously monitoring. No real change there. Next slide. There are no other major testing events scheduled at this point. There is the free testing site still at the Church of the Cross. If somebody wants to get tested again, they can go to that website, gogettested.com/Kansas, and then book a date and time in order to get tested at that site. Otherwise, it's still at this point through your primary care provider. Next slide. Vaccine updates. So we are right now in phase 2, which includes all those over 65, congregant settings, and in high risk or high contact critical workers. And I'll go into that in a little bit more detail in a minute. Originally, we tried open appointment system. And although that worked, I think it worked a little too well and was hard for people to be able to register that had issues with technology or a lack of technology. So last week we transitioned everything to a registration system. And then as doses become available, because our current estimation is only about 500 doses a week, then we can pull from that list and be able to get people scheduled, which currently is those over 65. The Salina Senior Center has been a great partner in helping people get registered over the phone. For those that don't have computers or internet. And as you can see right there, as of yesterday, there are currently over 6,000 that are registered. But at the rate of vaccine availability, this is going to take quite a long time still. Our short-term goal right now for those over 65 is to get about 30% of the over 65 population based off of our current US Census numbers, excuse me, which would be about 3,000 people in that over 65 category. And we're about halfway there right now. So we're still looking at least another 2 to 3 weeks before we reach that 30%. And then we will start adding in additional groups that are in that phase too. KDHE has listed a comparison of what the individual counties are getting for doses on a week-by-week basis. So if you're interested in looking to see what other counties around us or what, how the distribution is looking across the state, that county vaccine distribution comparison link there will show you how many doses each county is getting. Next slide, please. So as I mentioned, phase 2 is that persons over 65, those in congregate settings, and those high contact critical workers. And I've included in our slides, and if you'll go to the next slide, please, what the KDHE definitions and examples of congregate settings are. And you can see that includes homeless shelters, congregate childcare institutions, emergency shelters, correction facilities, adult care homes, etc. And then on the next slide, the high contact critical workers, that's our law enforcement, first responders, corrections, firefighters, grocery store workers, and the list goes on. You can see from those slides, including our over 65 population, that is going to be a significant portion of our population. And at the current rate of vaccine coming in, it's going to take us quite a while to get through all of those. So I ask, people to understand that this is going to be a slow process. We have a vaccine planning team that's been meeting since December weekly, looking at what the doses are coming in, what our numbers are, what we can expect, trying to plan out as far as we can, which is really only short range still because of those projections. Everybody that wants to be able to get vaccinated will eventually be able to get vaccinated. It's just going to take quite a long time. Next slide. So as we're putting out information, most people want to know, how do I find out what's happening? So we have many ways in order for people to get up-to-date information. One of them is through our press release on Monday, Wednesday, and Fridays, and our Vax Facts, which we try to include all of the most up-to-date information on vaccines in Saline County. Those are released on Tuesday and Thursday, and the link is there for people to sign up. I am also on KSAL providing updates on the first, third, and fourth Thursday at 8:15. I've been on KINA morning radio show every Saturday for almost the last year, providing updates. We have our social media for both the Facebook and Twitter. Last week, we recorded our first FAQ Friday video that aired on the Salina Media Connection, and the link is there if you want to go and watch that on their YouTube channel, where we try to cover some of the most frequently asked questions, hence the FAQ Friday, and provide answers to those that we can in general terms. And then, of course, our saline.org coronavirus page, where we have a lot of the links for much of this information. Next slide. So now we have kind of come full circle, where this time last year we were sitting, watching, waiting, preparing, planning to see what coronavirus was going to do and how it was going to affect things. And even though we've seen significant improvements in the county, we're still in a watching, waiting, preparing, planning, learning phase, as there are variants or mutations of the coronavirus that are popping up. there are several factors there that I've listed about why it's important that we watch these. We have already heard about some increased contagiousness, of course, with the UK variant. As of right now, what I know or what I have been able to get from information is that the vaccine will still work against most of these variants. There might be some differences later on as more information is learned, but we continue to watch and learn and see what's happening. So that means that people need to continue to remain vigilant about their mask wearing, their social distancing, watching their groups, their hand washing, staying home when they're sick. Last slide. And so, of course, that means continuing the mask order. And then also I added this last bullet in here. In case everybody wasn't aware, I was notified yesterday that the CDC has passed a federal health order that requires masking on all public transportation. So airlines, buses, trains, and that also includes train stations, airports, bus stations, transportation hubs, and the like. And that went into effect last night at 11:59. If anybody is interested in reading the full details of that order, I have provided the link there for that order. It doesn't really change what we're doing here in Saline County because we already have local mask orders. But anybody that's going to be preparing to travel will need to make sure that they are aware of those new rules. And with that, that concludes my presentation this morning.
Okay. Thank you, Jason.
You're welcome.
Jason,
any
this is, if I might, this is Commissioner Vidrickson.
Yes,
And you kind of touched on it, but I just want to clarify it. Last Monday and Tuesday, I know that the health department, along with the Salina physicians, gave out about 900 doses through Monday and Tuesday.
Yes, sir.
But later on, I heard that there was also a vaccination clinic on Friday. Is that the case? Was there something that happened on Friday also?
Not through our side. I think the hospital had some that they had to use up still, but
Okay.
Ours was Monday and Tuesday. Now,
Okay.
keep in mind, while these vaccine clinics are ongoing, and that's one of the logistical challenges with this, is that while we are doing, like last week, Monday and Tuesday, we did shot 1. We are also now into those windows where we are doing shot 2 on a lot of the few hundred shots that we gave throughout the beginning of January. And so we are getting into this consistent cycle where part of the week will be shot 1, part of the week will be shot 2. And so that's that ongoing amount of time and effort that goes into that.
Will there be cases or situations where primary or doctor's offices or clinics that they receive doses also and will be administering them?
I think further down the road, I know that was in part of the overall statewide plan that those different areas, including pharmacies, would be able to provide vaccinations. The challenge right now across the state is there's just not enough to add in a bunch of different other providers, because that 500 is all we're getting as a county.
Right, right.
Nobody else is getting any. It's just that 500. And when you add in 5 or 6 other providers trying to give, then that really dilutes out that availability. So once the numbers get up, that is, I know that the plan is for there to be many more providers, many more opportunities at different places to be able to get it. And if the Johnson & Johnson one that is now, I think, getting close to or about to end its phase 3 trials is provided emergency use authorization, that'll be another option for being able to get the public vaccinated besides the Pfizer and Moderna.
Okay. Well, and the reason I asked, Jason, was that I heard it was that the vaccination site was still out of JCPenney's, and I thought we were involved with anything that would happen out there. And that's why I was asking about last Friday, because I hadn't seen anything about that. So, but that was someone else private that did that.
Yeah, so with that vaccine site, it is a joint project between us, Salina Family, and Salina Regional. And so If in the future, one of them had wanted to try and do a vaccine clinic when we have more vaccine, but that would be possible through that site. However, we are all involved in the planning, the staffing, and the just being able to run that site, because it is quite a bit labor intensive too.
Right. One other quick clarification. As far as the people that are on the list for the future, I mean, I assume that they called by Salina physicians and taken in the order of which they signed up. Is that how that works?
Right. So everybody that has registered, it goes into a master list on the back end. And so like right now, since we're still focused on those over 65, Salina Family, as helping to manage that list, will be calling people in the order that they registered, though, for those that are over 65.
Okay.
When we start adding in other groups from those other phase 2 categories, that list is then sortable so that we can get, those that are over 65 and then whatever other group, because one of the questions on that registration does ask, do you live in a congregate setting? Are you a high contact critical worker? And then what field do you work in, so that we can be able to sort it that way as well. Registration also helps us in planning. So when we're looking at, say there are, say that there's 1,200 teachers, for instance, then we know that helps us with the planning of, okay, how do we try to manage trying to vaccinate all of a certain group?
One last question or comment. I'd like you to kind of clarify a little bit. And the ever-present rumor mill has it that on Monday and Tuesday last week that there were people from out of county, people from out of state even getting vaccinated at the Penny's site. Can you comment on that one way or another?
I don't know about out of state. There might have been a few from out of county. We did clarify as part of the registration process after that you have to either live or work in Saline County in order to register and get vaccinated here.
All right, thank you.
Jason, Commissioner Weiss here. I got a couple questions. The first
Yes,
question, with the new type of putting in your name into the hat, the old system you had, you got a confirmation back that you would be receiving this or that. Under this new system, is there any way that people can get confirmation that yes, you are on the list?
Yes, sir. We are working with the technology to figure out how we can get that. At first, it came up with a confirmation page, but we realized that a lot of people are looking for that confirmation email or something of that nature. So we're looking at how we can leverage the technology we're using to make that confirmation happen.
Okay, so, and that's going to happen on these people that have registered.
Right. So the ones that have currently registered, once we get this technology part figured out, which I hope we're able to this week, then everybody that's currently registered will get their confirmation email, and then anybody registering from this point forward will get their confirmation email.
Sounds great. I was just concerned because I know you don't want to be besieged with people calling in saying, hey, am I on the list? Am I on the list? I mean, you don't have time for that or the staffing to do that. So I just thought that would be a way for people to know, yes, rest assured you are on the list, and when your time comes, you will be contacted.
Yes.
My second question is, you mentioned when you hit the 30% threshold of 65 and older, you would start doing critical workers and other portions of the population. Will the 65 and older continue to get some, just not 100% of them? I mean, are you still going to bring the 65? Okay.
Yes, sir. If we waited, looking at the census numbers, there's a little over 9,000 or so over 65 based off the census numbers. And so, quite honestly, at about 500 a week, it would still take us, probably 16 weeks, something like that or more, just to get through them. But no, we will still be doing over 65 and adding in some of those. So the mixture, when we meet this week, we'll be talking about how we're going to start trying to figure out that mixture. But we still will be doing over 65 as well.
Thank you.
Commissioner Shadwick here, and I was contacted by a nursing home that has not received any of, nobody's gotten a shot yet. And I know that that's not that's going through Walgreens or CVS, I believe, isn't it?
Well, I spoke to them yesterday and we got what the back issue was figured out. So we're trying to work on a solution now for them.
Good. And is that through Walgreens or is that through us or?
Well, so with the CVS and Walgreens, they were primarily contracted to provide it to long-term care facilities,
Okay.
not necessarily retirement communities and assisted living. So there was something that kind of fell through there. Either way, I talked to the director over there at that facility yesterday, and we're trying to get a solution worked out so that we can get their residents taken care of.
Thank you for that follow-up. Appreciate it.
Yes, sir.
Hello, Jason. Roger here.
Yes, sir.
Quick question here is like in a statement you made a little earlier is that that you're putting in all these people that have signed up are in a list, and that's how you call them back as how they've entered in, right?
Yes, sir.
Okay. And now at 30 or 35%, now you start accepting more. And let's say a 92-year-old person has signed up and now they keep getting bumped because you've taken all these new people in. How do you arrange those numbers when you start taking in new people? And
So,
who do you,
I see where you're going. So those that, for instance, and I'm just using a hypothetical right now because we haven't finalized our procedure on that. But say, for instance, with our next run of doses, say we get 500 and we say that we are going to do, I don't know, an 80-20 split, 80% over 65, 20% of other and that high contact critical worker. So since it's all in a spreadsheet still, we'll go down that to whatever number fills at 80% still of those that are over 65 who have signed up. And then we will start through the other categories in that 20%.
okay.
So those that are over 65, it's not like they're going to get bumped. It just means that in this run, we won't be able to take 500 over 65, for instance. It'll be a less number, but they're still in their same place on the list based off of when they signed up.
Okay. Thank you. That good explanation. Yep. Thank you.
You're welcome.
Any other comments?
Jason, one last question. Commissioner Weeds here.
Yes, sir.
Did you receive any vaccines last week that you were giving out this week?
Yes, we have 500 that we are doing that we received last week that we are vaccinating with this week. We are estimated to get 800 this week for next week. We haven't received all of that yet, but we are estimated that. So we'll be making appointments for potentially that many next week. And then whatever we get notified of this week that we will receive next week, we'll make appointments for the week after that.
Okay. Any other comments? Okay.
Yes,
So
I have a comment,
Oh.
Mr. Chair.
Yes.
Jason, I've heard good reports for your vaccination facility. It seems to be running smooth and a few wrinkles worked out at the start, but congratulations to you and your partners you're working with to make that successful.
And I appreciate that. And I do want to give another shout out to them real quick, to Salina family and Salina Regional, because without that partnership, trying to run this facility like this and do this many vaccinations would be an extreme nightmare. And so it's with those partnerships that we're able to do what we are doing here in Saline County to try and improve the COVID situation, as well as trying to get people vaccinated. And those partnerships are extremely important. So I just want to give them one last shout out before I wrap up.
Okay, thank you. And I'm sure there's a consensus just to go ahead and leave the face mask going as for the next 2 weeks. Seeing that, thank you, Jason.
All right, thank you, gentlemen.
Next item.
Item number 4, RFA 116-21, Project Management for Livestock and Expo Center with Hannah Stambaugh, Deputy County Administrator.
Good morning, Hannah.
Good morning, Commissioners. So as you remember, in 2020, we obtained a long-term lease with the City of Salina for the Livestock and Expo Center. And as part of that lease was a list of some minimum maintenance and improvement items that we have got to complete within 5 years to make sure that we satisfy the terms of that lease agreement. Back in October of 2020, we had a conversation with the commissioners as far as moving forward with completing those projects. And after our discussion, our staff did move forward with soliciting requests for qualifications for project management services to help us with completing those projects, as well as looking at helping us with some long-term master planning, and then looking at potential costs or even architectural engineering studies for any future capital projects that were not already listed on the minimum maintenance and improvement items. So on December the 21st, we received four firms or individuals that submitted their qualifications. We received qualifications from BG Consultants out of Manhattan, Kansas, Hutton out of Wichita, Kansas, Benson Method out of Overland Park, and A+ Architectural right here in Salina. Our staff reviewed each of the submissions and we graded them specifically on their experience, their capacity that would be related to a long-term project, basically the 5-year project timeframe, some of their past performance, and then also their experience on working with government projects. Through both the individual and the group evaluation, Hutton was the one that received the overall highest score, as well as the highest marks from the references that were contacted. So this particular request for action is to enter into a contract with Hutton for project management services. It would be at an hourly rate that is established in the contract, with also the option in the future to evaluate those other capital projects that the commission might consider. So your alternatives are to approve the contract with Hutton, to approve a contract with one of the other firms or individuals that submitted their qualifications, or do not approve any contract and provide staff with further direction. Of course, our staff recommendation is to approve the contract with Hutton to perform project management services. County Council has reviewed their contract and has approved it. To talk a little bit about the budget piece of this, each one of the firms were provided those minimum maintenance and improvement items that are to be completed within the next 5 years. The best estimate that we could get from Hutton based off of their hourly rates and the services for them to provide is a range anywhere from $45,000 to $65,000 that will be paid for with those capital improvement dollars. Any other improvement items, such as any of those other capital projects that the commission would want to consider that would require any type of architectural engineering designing features, that would be a complementary contract to this original one. And that would be at a percentage or a lump sum part of the project and not as an hourly rate. So subject to any questions, that is the request that is before you today.
Thank you, Hannah. Are there any questions or comments from the commissioners?
Yes, this is Commissioner Vidrickson. Hannah, you've got it down here that Hutton is Wichita, Kansas. And I think it's my understanding also that the Hutton does have a field office or an established office here in Salina. And they purchased the previous Bus Boom and Row construction company. So they do have a presence here in Salina. Is that correct?
That is correct. The project manager that submitted the qualifications, his office is out of Wichita. They also have, I believe, an office in Kansas City as well. They've got a couple of different locations that they are in, but primarily the point person that we would be working with is out of Wichita, but they do have a presence here in Salina.
Okay, well, they're a well-known firm and with lots of action going on all over the state and well qualified, I'm sure. So that's my comment.
Are there any other questions from the commissioners? Are any members of the public who wish to speak?
Mr. Chairman, I do not see any hands raised at this time.
Okay, thank you. I will bring it back to the commission for more discussion or possible action.
Commissioner
Mr. Chairman,
Go ahead.
Go ahead.
Yes. Go ahead, Robert.
It's all right. I'll mute. Go ahead, Monty.
Okay.
Mr. Chairman, I move we approve by signature the Hutton Corporation Project Management Services contract as presented by staff.
Okay.
Commissioner Weiss, I second that motion.
Okay, it's been moved and seconded that we RFA number 11621, project management for livestock and expo center for Hutton Construction. Are there any further comments? If not, I will call for a vote. Commissioner White,
Aye.
Commissioner Weiss,
Aye.
Commissioner Vedrickson,
Aye.
Commissioner Shadwick,
Aye.
Commissioner Sparks, aye. The motion passes 5-0. Thank you. Next item.
Item number 5, RFA 117-21, Rural Fire District number 7, donation of air pack cylinders, with Hannah Stambaugh, Deputy County Administrator.
Good morning, Hannah, again.
Good morning. I'm here on behalf of Rural Fire District number 7. They are requesting for commission approval to donate 14 Scott brand 2200 PSI aluminum cylinders to the Osborne Fire Department. These cylinders are no longer used in the air packs that Fire District 7 uses. And then also there's only one other district that utilizes them, but they only utilize them for training. They were contacted and they were not interested in having these donated to Fire District number 6. So this particular department is just requesting to donate them to the Osborne Fire Department. Fire District 7 did receive these on a donation back a few years ago. And since then they have just upgraded into using composite 4500 cylinders. So these are just ones that have been sitting in the fire station for a couple of years now, and the fire district just feels it can be used better with another volunteer fire district. There is no budget impact on this. Once donated to the Osborne Fire Department, the Osborne Fire Department would become responsible for this equipment. And again, these cylinders are no longer used. The fire district also did look into selling them, but based off of current prices, they just didn't think it would bring any type of significant profit whatsoever. And again, feel that it would just be better served with another volunteer district or fire department within the state of Kansas.
Okay, thank you, Hannah. Yeah, sounds like a good deal. So are there any other comments from the commissioners?
Commissioner Vidrickson, and I think that we should go ahead with this and be a good neighbor to Osborne County and Osborne Rural Fire. And the fact that we have had them donated to us, I really like the fact that we can just pass them along and someone else have good use from them. So I'm fully in favor of it. So.
Yes, thank you. Any other comments by commissioners? Any members of the public who wish to speak?
Mr. Commissioner, nobody, Mr. Chairman, nobody has their hand raised at this time.
Thank you, Brad. I will bring it back to the commission for more discussion or possible action.
Chairman, this is Commissioner Shadwick, and I move we approve the donation of Rural Fire District number 7 cylinders to the Osborne Fire Department as requested by staff.
Commissioner Weiss, I second that motion.
Are there any further comments? If not, I will call for the vote. Commissioner White,
Aye.
Commissioner Weiss,
Aye.
Commissioner Vidrickson.
Aye.
Commissioner Shadwick,
Aye.
Commissioner Sparks, aye. Motion passes 5-0. Thank you. Now we'll move on to informational items.
Item number 1, Saline County Committee for Reducing Jail Population.
Good morning, Mr. Chair, members of the Commission, Phil Smith Haynes, County Administrator. I'm bringing this item before the Commission today for discussion. This is in follow-up to comments that Commissioner Shadwick made during the reorganizational meeting of your commission. Too many words running together there. Back in January. And so I have reviewed the existing bylaws that were established for the Committee for Reducing Jail Population pursuant to Amendment number 1 to the Resolution 15-2178 adopted August 1st of 2017. And I have some suggestions that I think the Commission might want to consider if you wish to continue with the committee, or alternatively, I think it might be time to decide whether you want to not continue with the committee. So I'd be happy to address any questions and see if Commissioner Shadwick has additional comments as well.
Okay.
Yeah, just a couple things. You know, when I was reappointed to this commission, it just made me kind of think of you know, where we've been, and is it appropriate? Does this commission still think that that's a priority, etc.? A little history on this is, we started this, I believe, Philip, 5 years ago, maybe 6 years ago, trying to address the obvious concern of all the, you know, the prison overcrowding and spending $1 million a year and shipping people off, and, you know, is there better ways to do things? It was a pretty big committee, wide range of individuals, and over time it just became a build a jail committee, and the committee was reduced to a very small group, and the focus you know, wasn't about reducing the jail population, it was about building jail, which is fine. You know, that's all good. The jail was built, and but I'm not so sure that there's unless the commission kind of comes back with, okay, it's time for us to continue to do some of the things that we looked at. You know, I feel like if we do this committee again, we're going to have to recontact some people, get them back to going, and then, you know, what is the direction? What does this commission want? There were some good things that came out of that. You know, the two things was a drug court, which I think everybody agrees was very successful. We probably could expand that into other areas. And then the Annie's program that has done so well too. I know that there's some struggles there, but I think that that's been a very successful program. So that's kind of my thoughts, and didn't know where the rest of you stood on this. I'm happy to be on the committee again, and happy to work at, you know, continuing to try to reduce the jail population, because the trends aren't good. We don't want to be in a situation where this one now is.
Okay. Thank you, Monty. Are there any other commissioners who would like to comment? Seeing none, are there any public that would like to comment on this situation?
Mr. Chairman, we do have someone with their hand up. I will ask Lene Meyer to unmute her microphone.
Okay. Good morning, Lene.
Good morning. I really want to support continual looking at ways to reduce population.
Lene, excuse me, but could you state your name and your address?
Oh, sorry, Lene Meyer, Huntington Road, Salina.
Thank you.
I really want to support continuing to work on ways to reduce the population. I was a big advocate for a new jail, not to keep more people in as a moneymaker, but to do things to add space where we could treat the people in jail with more and perhaps advanced ways of helping them learn that they are more than just their behavior. And so I'm a strong advocate for the council. I don't totally understand what the council is all about, but I'm a strong advocate for anything that will take a look at a big picture and use the added space in the new prison or in the new jail to help people take a look at themselves at a very deep level and hopefully make changes so they don't keep going back. Thank you.
Thank you, Lene. Any other public comments?
Well, this is Commissioner Vidrickson, and I strongly agree with Ms. Meyer regarding this. On the other hand, I think with the new jail that we're going to have room in there for programs and so forth that will potentially take the place of this this jail reduction committee. At least that's my thinking, that hopefully that's what will happen through the programs that will be established within the walls of the jail itself. And I'm hoping that happens. Now, do we need a citizens group slash committee slash commission group? I don't know. But I certainly am thinking that when the new jail is built, that will certainly be a priority. I know it will be a priority with Sheriff Solden to address these situations. So.
I just want to clarify. This is Commissioner Shavrick, and I do want to clarify. You know, I said something about Annie's program and failed to kind of mention the name, but pre-trial program came out of this. Drug court, obviously, I mentioned before, and I think that there's potential to maybe even do a veteran court that's very successful around the country. I also think that I still would like to see this committee do things because Commissioner Vidrickson's point about the jail is well taken, and I agree with him. But I think that they're going to be so concentrating on the building of the jail for this next year, and I think somebody outside of the system looking at issues would be helpful. I also think we have a county attorney that's interested in looking at different things helpful on reducing the jail population. So again, I think Commissioner Vidrickson might be right down the road, but right now I think that a separate citizen group, I think, would be.
Commissioner Weiss here. I would refer to Monty, whether you've served on that for so long that you know what has worked and what hasn't worked, whether it's the size of the committee, the people they brought together. Are there anything you would suggest happen if the jail committee continues to change the format or the structure of it?
Well, I think my timeline might be off a little bit, but I think it was originally we had like 15 people on there, 18 people. That was burdensome. Meetings, I don't know. And just as the time went on and you know, successes of the drug court and the successes of the pretrial and the judges being a, you know, buy-in and all this was good, but then the focus of this just went to fail. And so we probably haven't met or talked about any other programs for the last 2 years. I'm thinking probably somewhere in the middle of that 15 to 18 to a 5 or 6 jail committee people. So, you know, 7 to 9 folks, I think would be helpful. And again, they won't be making any decisions. sheriff, somebody from the sheriff's office will obviously be part of that too. But I think we could get back together and just start brainstorming some things with a group about 7 to 9.
This is Commissioner White. A couple of comments basically for Commissioner Shadwick. And I guess my question is, or my comment basically is, thank you, Monty, for bringing that to our attention. That's something that we kind of overlooked. And with your expertise and your knowledge and your history, would it be possible that you got with Phil, who has some ideas on the numbers and all that, and maybe bring back a recommendation with even some names that we could appoint? I'm assuming that needs to be appointed by resolution anyway. Would you be willing to do that?
Yes, Commissioner, I would. And I think that just we'd probably tweak the original resolution. I've looked at it a little bit. I don't remember reading that 5 years ago or 6 years ago, so it needs to be tweaked a little bit. I would also lean on Andy Grievous, probably, who's been on the committee the entire time also. And I think between us, we can kind of come up with something and bring it back to the commission.
Sound like a plan. Thank you.
Good one. Yep. Thank you, Monty, and all the commissioners. Any other comments? Okay. Are there any commissioner updates? Administrator updates?
Yes, so thank you, Mr. Chair. County Administrator Phil Smith-Haynes again. 3 things that I wanted to mention today. Legislative update. We've talked for the last 2 weeks about Senate Bill 13. They did have the hearing last Tuesday afternoon, and I listened into that. It was an extensive hearing, lasted about 2 hours. There were a number of suggestions for amendments, and I believe they are intending to work those amendments in the House Tax Committee this afternoon. So I will try and tune in again and see where that goes. Also, yesterday afternoon, the City of Salina City Commission held a study session on housing. And ultimately, they decided on a 2-pronged approach. They are going to revise their housing study, but the commission has also asked for presentations of specific proposals to be brought forward to them. The city staff has been contacted by some developers who are interested in housing development. So continue to monitor that, just from the standpoint that some of those developments are asking for tax abatements that would potentially affect county revenues as well. So just continue to maintain that as a point of interest. And then I thought I would throw in something a little bit different this week. Last week, I attended a conference. Attended is an interesting phrase this in the current environment because everything is on Zoom. So I sat at my desk for 6 hours last week and watched people on video. But it was actually good, particularly the second day. Got a lot of tips in the areas of emergency management, budget communication, and some things that we can do with our staff. So I've already been sharing those with emergency management. And next week, Wichita State will be doing their winter conference for managers in the same format. So if you see me with my door closed, I'm at a conference again. So, but those have been pretty valuable so far. Looking forward to next week. That's all I had for today, and I'd be happy to answer questions.
Okay. Are there any comments? Any commissioner comments? Seeing none, are there any announcements? And I guess it looks like we have a executive session.
Yes, sir. Staff would request an executive session for 20 minutes for the purpose of discussing employer-employee negotiations.
Chairman, I move we recess into executive session under the employee-employer negotiations exemption to the Kansas Open Meeting Act for 20 minutes and reconvene in this room at 10:25.
Commissioner Weiss, I second the motion.
Are there any other comments? Seeing none, I will call to a vote. Commissioner White,
Aye.
Commissioner Weiss,
Aye.
Commissioner Vidrickson,
Aye.
Commissioner Shadwick,
Aye.
Mr. Sparks, aye. Motion passes. And I recess at executive session under the employer-employee negotiation exception to the Kansas Open Meetings Act for 20 minutes and reconvene at 8:25. We are back into regular session. Can I get a motion that we go back into executive session under the employer-employee negotiations for act for 10 minutes and reconvene at 8:37.
And 10:37.
Yeah, 10:37. I'm sorry.
So moved.
Second.
It's been moved and seconded that we go back into executive session. All, Commissioner White,
Aye.
Commissioner Weiss,
Aye.
Mr. Frederickson,
Aye.
Mr. Shadwick,
Aye.
Mr. Sparks, aye. Motion passes 5-0. We are back into executive session. Are there any other comments?
Move we adjourn.
Roger, you better bring us back into regular session.
We are back into a regular session at this point. And are there any other comments to be made at this time? There's no action out of the executive session at this time. So at that, this meeting is adjourned. Thank you.
Okay.